All right, so this is the doffing video, probably the most important thing that we should really focus on when it comes to putting on, taking off, or donning and doffing the PPE. At this point, we're going to assume that the person has been exposed in some type of patient contact, whether it be a simple coughing patient or all the way up to a cardiac arrest with fluids all over the place. What we're going to do is a gross decontamination of the PPE with either a spray bottle, pump sprayer, wipes, whatever we have. We should have a partner wipe the person down, spray the person down with a hand sprayer, or we have the atomizer machine gun thing, or the pump sprayer, and take a towel and just grossly decontaminate the outside of the suit. You can also do it with purple top wipes or bleach wipes, whatever we have available. We're not sure exactly, what we'll have for supplies moving forward, but we should at least do a gross decontamination of the suit, focusing especially on obviously the gloves, and we got to be careful. Obviously, we don't want to be spraying the member around the area where the mask is. We want to try to, keep the bleach off of the areas that are unprotected. Now, the first step in the doffing procedure after spraying and wiping down would be safely removing the outer gloves. The outer gloves, common sense tells us we don't want to take our thumb and stick it down into the inside part of the glove. We want to pinch from the outside, and we want to be careful not to snap the glove off, as there could still be bodily fluids or respiratory fluids on the glove. We want to be careful, pulling it down slowly, trying to roll it into itself, and keeping anything that was on the outside to the inside at this point. And then obviously the other glove is kind of more difficult because we don't really want to use that inner glove if we can help it. This is why we try to wipe down before removing everything. You may need a partner to help you at this point to remove that second glove with a clean pair of gloves that they can remove safely also. We don't want to go underneath it if we can, but the other person is clean so they can, and then slowly remove the glove. Now we should basically assume that those gloves are fairly clean unless they've been broken or cut. And now the next step would be the mask. So we want to carefully remove the cap and mask, and we want to try to do the same thing as with the gloves. We don't want things to go flying. We want to do it slowly and methodically, and maybe at that point it wouldn't be the worst idea to kind of hold your breath for that 1 second as you take the mask off. After that, we want to safely be taking all of these contaminated PPE pieces and using our partner or our assistant to safely, get rid of it. Hopefully we're not doing it in the truck or somewhere like that. We can dispose of it.
There will be a bin outside all hospitals.
So now at this point, it would be the gown that's going to come off. So you would fully want to unzip it slowly and methodically, because again, we don't want any liquid or any particulates to get thrown around. And now we'd want to pull it basically just like the gloves, inside out, and try not to get the exterior part of the suit on your person at any time. Now, these suits at this point can be ripped. We don't need to worry about keeping them together, but we want to stress that we want to try to not let the outside of the suit touch the member at all. This is when a partner can come in handy. At this point, you can rip that bottom zipper also to give yourself a little bit more room to work. The booties and the suit should come off probably in one piece at this point. There's no point in adding a step of removing the booties, and it's probably safer to go from the inside out. And you can just put the suit on the ground and step on it and step out. And you can rip that suit or those boots or the bottom of it too to give yourself more room. And now we want to pick it up, rotating the inside, from the outside in, and then carefully and methodically throw it away. We shouldn't be moving fast or snapping gloves or ripping anything off quickly. Everything should be done slowly and methodically. And now at this point, the inner gloves can be removed just like we did the outer gloves without exposing the inside. Slowly removing them, rolling them into themselves. And then at this point, obviously, the goggles can be removed, and the member at this point should be using hand sanitizer, or if we can, obviously hand washing with the appropriate soap would be even better. And you can roll that all the way up your wrists. And remember, we're washing not just our hands, but we should be washing at least halfway up the forearm. There's a couple of other notes that we're trying to get across to everybody. There will be no all right, so there is one other note. We're not allowing any family members to transport to the hospital unless the patient is a minor. That's the only exception. For the most part, the hospital is not allowing visitors whatsoever, so we shouldn't be bringing anybody to the hospital. This is for basically their safety and the safety of other healthcare workers and ourselves. There will be maybe a policy coming out where we'll have drivers or first responders who are going to be in the front of the ambulance on these calls, and they will stay in the front of the ambulance on these calls. They will not get out. We should be using one member to go into a house, see exactly what is needed, see if the patient can self-extricate and ambulate out. The other member should be staying outside to limit exposures and basically be safer on every single call. More notes to follow. The chief is working on policies as we speak, and he's ironing out more details. Keep an eye on your emails.
Yep.
And be safe, guys.
A2 is going to be primary until this is all over. And I just want to thank Angel and Brian for this, their help. All right, thanks.